Hai, Assalamualaikum. This is your presenter. My name is Fazlyn Aini binti Mat Arifin 050230. I will present about the Delta variants. At first, I will explain about COVID-19 disease. Actually, COVID-19 is an infectious disease caused by the novel coronavirus 2019, a type of virus closely related to the SARS virus. The disease was discovered and resulted in an ongoing pandemic. The main mode of infection in humans is human-to-human transmission, which is usually occurs through respiratory droplets from infected individuals when they sneeze and cough. The first case was recorded in December 2019 in Wuhan, China. The first 41-year-old Malaysian tested positive for COVID-19, but Malaysia's first death was recorded on March 17, 2020, where a 60-year-old priest in Sarawak was confirmed dead. How about Delta variants? Okay, the Delta variant is the most dangerous COVID-19 mutation in the world. The infectious rate of Delta variants was higher, like twice as contagious than the Alpha variants. At the end of 2020, this Delta variant was first detected in India. This variant has triggered the COVID-19 tsunami in India so much. This variant also has invaded dozens of other countries. As of July 2021, this Delta variant has spread to more than 96 countries, including Indonesia, Netherlands, Russia, Thailand, and also Malaysia. Today, the Delta variant has become the dominant variant in UK as well as several other countries such as Pakistan, Bangladesh, Sri Lanka, and also Indonesia. In Malaysia, the first case of Delta variant reported was from a local. According to the Director General of Health, Tan Sri Dr. Nur Hisham Abdullah, the individual is a close contact of Indian who both board a flight from Kuala Lumpur to Labuan on 23 April 2021. How do we know about the symptoms present in the Delta variants? Okay, let's check it out. If you have fever, sore throat or cough, no energy and always tired, nausea, loss or sense of smells and also taste, influenza and also symptoms, and also have symptoms of long COVID, you need immediate medical treatment. This is because most likely you are being infected with the COVID-19 disease or maybe variant Delta. And of course, we need to know there are many affected of Delta variants. The first is health sector. This sector is really affected, which is as new cases increase, more and more patients are placed in hospital until there is congestion in the hospital. Second is economic sector. When this economy was ordered to close and stop operating, it affected many parties. Next, education sector. This sector is a concern for parents when institutes and schools have to close and affect children learning. Although the government has taken the initiative to run online distance learning to children, it still worries parents because face-to-face school still give the best focus for their children. After that, the aviation sector. A week of not operating alone can cost billions of dollars in losses incurred by airlines. This was clearly evident when Asia Berhad took various initiatives to defend its company despite having laid off many employees. And lastly is tourism sector. Almost all these sectors are becoming paralyzed because the people are prevented from going on holiday anyway. At the moment, we talk about later COVID infection and the emergence of Delta variants. What is the cure behind it? What should we do to treat and also prevent this Delta variants from spreading across the country? Okay, let me explain what we need to do to prevent all this one by one. The first is you need to wear a mask. The main measure of prevention is to cover all the causes that can be attacked by the virus, such as the mouth and nostril. Second, you need to wash your hands often. This practice to ensure that we are always clean and safe. The function of the sanitizer is proven to be a bacteria killer. Next, you need to stay keeping this distance. Distance care can ensure that oneself is always protected and infection-free. And the most important right now is vaccines. No matter what is going to happen or has happened, you need to be vaccinated as soon as possible to prevent COVID-19 infection. And lastly, update the status in My Sejahtera application. This initiative from the government is one way to identify the status of COVID-19. When the status is updated, Ministry of Health can detect you are a close contact to a COVID-19 positive patient or can also protect others when you are positive. It is only visible from the data you update daily. In conclusion, this Delta variant is very dangerous. So, cooperation from all parties must be fostered because without the cooperation of all, this pandemic will again and again spread and create new clusters. Protect yourself, protect all. And supposedly, we need to make other countries that have already managed to run away from this Delta variant as a role model. If they can, why can't we? We can be like them too, right? For me, of course, we can too. That's all from me. Thank you.